Welcome to PCR London Valves 2024. My name is Marianna Adamo from Brescia, Italy, and I'm here today with Roy Estevez from University Hospital of Vigo in Spain. So welcome, Roy.
Thank you.
So the topic today is how to manage conduction disturbance after implantation of transcatheter tricuspid valves. This is a quite important issue as a complication of this kind of procedure, and the prevalence is significant, is around 10-12%. It depends on the kind of valve used. So my question is, Roy, what is the mechanism leading to this complication, and are there predictors in order to prevent this situation?
Thank you, Mariana. This is a fantastic question, of course. So mechanism probably is the mechanical pressure of the valve to the conduction system, which is in the interventricular septum. So, of course, there's some design features of some valves that make this more frequent. Probably Evoque has this ventricular legs design that impact more in some cases. In Evoque, it's not a matter of oversize, but in other valves could be a matter of oversize of the valve from the size of the annulus. So you have to pay attention to those factors.
Can we use some parameters to predict this situation?
So even though it's important feature, I mean, TTVR is a novel strategy for treating patients. We don't still have a lot of data to find predictors, but the only study that has focused on that found that the presence of left ventricular branch block or fascicular block were the only predictors for AV block after the implantation. So probably those patients should be more careful monitoring. Mm-hmm. And talking about monitoring, Mariana, how long do you think we should monitor patients after the implantation of these devices?
And that's a good point, because as compared to TAVI, for example, the onset of this complication is a bit late. It occurs later. So generally hours or days after the implantation. So it's important to monitor patients, I think, for at least 3 days after the intervention, and if there are some sign of alterations on the ECG, we can also prolong for more days, like 5 or 7 days, because we know that the AV block can occur up to 7 days after the procedure. So the monitoring is crucial in this setting. So, Roy, regarding the management of these patients, how do you prevent, how do you manage this complication during the procedure and after the procedure? So, if you need a pacemaker, if there is an AV block, how do you, which kind of pacemaker do you choose?
So that's, of course, a fantastic point. So first, I have to say, usually the AV block is preceded by some slowdown of the heart rate. So it's important before the procedure and after, if you see some slowing down of the heart rate, to remove all the drugs that can impact the conduction in AV node, withdraw beta blockers or digoxin. That's important. And in case we have a complete AV block during the procedure, that this is really uncommon, you can pace through the wire that is usually in the apex and have some time to implant a pacemaker at that moment. In case it happens, as is common in the first week, we have to set a strategy for valve sparing pacing options. Most of cases has been done through the coronary sinus to a lateral vein in the ventricle, or even leadless pacemaker. I think that the two main recommendations for this kind of complication.
Thank you very much, Roy. So we can conclude this PCR perspective session saying that disturbant complications after transcatheter tricuspid valve replacement is a common complication, but it can be managed. Even if we don't know the predictors of this complication, it can be managed during the procedure and after the procedure with a pacing wire during the procedure and monitoring the patient after the implantation in order to avoid further complications. So So, of course, we need further studies to better understand the possible predictors and to have possible further strategies to prevent and treat it. Thank you very much.